The U.S. becomes the new battleground in the fight against coronavirus. Health workers struggle to contain the rise in infections, and they're running out of supplies. So, what needs to be done to prevent the crisis spiraling out of control? This is Inside Story. Hello and welcome to the program. I'm Mohammed. Jamjoom. The World Health Organization has warned the epicenter of the coronavirus pandemic could shift to the United States. Although Italy, Spain, and China have higher death tolls, the U.S. now has nearly 165,000 infections, more than anywhere else in the world. The state of New York has the biggest number of cases. A U.S. naval ship with 1,000 hospital beds has arrived to provide relief to overwhelmed hospitals. And emergency medical centers have been set up across the country. But health workers say they're running out of supplies and testing kits. New York's Governor Andrew Cuomo is asking states with fewer cases to send volunteer doctors and nurses.
If you don't have a health care crisis in your community, please come help us in New York now. We need relief. We need relief for nurses who are working 12-hour shifts, one after the other after the other. We need relief for doctors. We need relief for attendants. So if you're not busy, come help us, please, and we will return the favor.
Earlier this week, the top U.S. health official predicted there could be up to 200,000 deaths in the U.S. The president has been criticized for downplaying the crisis. Donald Trump says the number of cases there won't reach its peak for a while.
Challenging times are ahead for the next 30 days, and this is a very vital 30 days. We're sort of putting it all on the line. This 30 days, so important because we have to get back.
So let's take a look at why scientists are so worried about what's happening in the U.S. The University of Oxford has been tracking how long it takes for new infections to double in each country after the first 100 cases. China reported a doubling of every 2 days when the outbreak began 4 months ago. The numbers are now steady after Beijing imposed mass lockdowns and travel bans. Italy's infection rates are starting to double more slowly to every 4 days. There are early signs in Spain as well that the numbers may be stabilizing. But in the U.S., the infection rate is still doubling every 2 days or so. All right, let's bring in our panel. Joining us from Washington, D.C., Julie Fischer, Associate Research Professor of Microbiology and Immunology at Georgetown University Medical Center. In Oxford in the UK, Dr. Peter Drobak, co-founder and first executive director of the University of Global Health Equity in Rwanda. And also in Washington, D.C., Adam Goodman, Republican strategist and partner at Ballard Partners. Welcome to you all. Julie, let me start with you. Just how bad is the situation currently in New York, specifically in the hospitals?
Right now, New York is seeing cases of COVID-19 double every day. So it is on a very high trajectory, and the number of cases is growing more quickly than the health systems are able to accommodate. They're already facing dramatic shortages of intensive care beds and of ventilators for the people who are most severely ill. And we're still seeing the number of cases rise, with the expected peak still about a week away. So it's a pretty severe situation right now.
Adam, President Trump has expressed optimism about the federal government's ability to provide adequate coronavirus testing, but that's very different than what we're hearing from state governors, right?
That's true. You know, the president is in a position where you could argue very persuasively he has to balance realism and optimism, because if that gets out of whack, I think this whole thing starts to become a much more difficult assignment for people across America to handle. He's been criticized for that, for being maybe a little bit too optimistic. I think that's actually the right tone to play. And we've seen others across the country. We just heard in the pre-roll Governor Cuomo, who I think's done a terrific job of really soberly addressing this day to day with the people of New York, putting what is most important on the table, trying to take politics out of it. But for the president, who now has his nightly press conference, which has become must-watch television across America, I think it's appropriate that he gives us a reason to look forward as opposed to the fear of looking at where we are today.
Peter, as a public health expert, from your vantage point, tell us about what you're seeing when it comes to the effectiveness of measures put in place in the U.S. versus in other parts of the world.
Well, overall, the U.S. response has been certainly slow, and really a lot of valuable time was lost. Certainly when you compare it to other countries that acted more quickly. South Korea had its first reported case on the same day as the U.S., January 20th. They sprung into action. They scaled up testing very widely and contact tracing and the usual sort of public health measures to address an epidemic, and have really been able to contain theirs. There have been fewer than 150 deaths and actually declining in South Korea. We've seen obviously just the opposite in the U.S. and it's, as things continue to ramp up, it's extremely concerning. One of the challenges has been really kind of a patchwork response across the U.S., where in some places like Seattle and the San Francisco Bay Area, some early social distancing measures appear to have paid off in terms of flattening the curve a little bit. But obviously we see some other cities that appear to be just behind New York City, like Detroit and New Orleans, that appear to be, next in line for really becoming overwhelmed.
Julie, it looked to me like you were nodding along to some of what Peter was saying. Did you want to jump in?
Yes, and I think as Peter was pointing out, where communities have implemented some of these social distancing measures early and in a whole scale way, so not a patchwork from location to location, community to community, they're starting to see some of the benefits in terms of burden on the healthcare system. The whole point of these social distancing measures is to use the only tool we have right now in the absence of an effective treatment, in the absence of a vaccine that we can use today. What we have as a tool are these social distancing measures that can help slow down transmission at the community level. And the outcome of that is that we can spread out the number of cases, as people are starting to learn as a watchword, flatten the curve, so that the number of new cases occurs more slowly, and our healthcare services can provide enough intensive care beds and enough intensive care nurses to take care of the people who might be ill in a community, with it spread out over a longer time, rather than everyone becoming ill at once and really overcoming the healthcare system.
Adam, given the lack of testing kits, do we have an accurate understanding, a realistic idea of the numbers at play when it comes to coronavirus infections in the U.S. right now?
We certainly don't. I don't think anyone in any major country around the globe has an answer to that one. And of course, as we hear from Dr. Fauci, who I think this will date me a little bit, he reminds me of Doc Welby, the famous made-for-television doctor who always made you feel good, even in the most grim of circumstance. When Dr. Fauci, addresses that, he still is uncertain, and he keeps saying, and he's right, as does Dr. Birx and a lot of other public health professionals, that we need more data to truly understand just how big this could get, what it means when you hit an apex. Is it a single apex? Is it multiple apexes in terms of the curve? We've now come to follow the COVID-19 curve more religiously. People have, certainly in this country, than the Dow Jones Industrial Average, as a sign of our, you might say, collective health. So what I'm trying to say is that the more we know, which means data, the more information we get, the better we're going to be and the more equipped we're going to be, maybe not to be perfect, because clearly we're not going to be in handling wave one, but I think we're going to be ready for what's ahead.
Peter, more and more the past few days, we are seeing medical workers in different parts of the U.S. utilize social media to showcase these horrific conditions that patients in the U.S. and healthcare workers in the U.S. are now confronted with. These are striking and very sad scenes, and I'm curious about how this is playing out in the rest of the world. I mean, how remarkable is it that people are seeing these kinds of scenes take place in the U.S.?
In the richest country in the world, it's tragic and it's shameful, frankly, that that our lack of preparedness put us in this situation. And it raises a greater danger, not only that our health workers, the heroes on the front line who are sacrificing themselves or taking risks to save lives and protect the rest of us, are not themselves getting adequate protection. But one thing that we saw in Italy as the health system was overwhelmed was that hospitals themselves became epicenters of transmission because they weren't able to implement effective infection control. Health workers might have been infecting other patients who were in the hospital for other reasons. And you started to actually see that even social distancing measures in the community were compromised by transmission that was happening in hospitals themselves. And so this is something that really needs to be urgently addressed. And for the rest of the US, they need to look to New York and realize that they don't have much time to get ready.
Julie, how big of a challenge is it right now that the healthcare system in the U.S. doesn't operate in a coordinated manner?
It's a tremendous challenge. And I think one of the biggest obstacles for the US, as opposed to some other health systems worldwide, is that our health system is very decentralized. It's not a single unit, but a combination of many systems ranging from large hospital networks down to small health facilities operated by a single nonprofit or private sector organization. And they're not used to working in concert in any coordinated way for the procurement and movement of medical supplies, which is right now what is one of the biggest challenges, making sure that we have enough ventilators and enough personal protective equipment for our healthcare providers to care for those who are severely ill, and to do so in a way, as just mentioned, that does not put themselves at risk and prevents them from becoming a source of infection for others. So we're really struggling in the US right now with the structural limitations of our system. We're not used to managing medical supplies on a nationwide basis. And we're not used to trying to project across an entire health system using mathematical models what the burden might look like as the epidemics in individual communities across the country emerge on slightly different timescales.
Adam, it looked to me like you may have wanted to jump in, but let me also ask you, from your perspective, how well are Americans adhering to social distancing guidelines?
They're getting there. I think in New York, it was almost an overnight wake-up call that got everyone kind of pulling together, understanding this was not an optional suggestion, but a mandate that everyone had to follow. And there's a sense that, and this is owing to a lot of the communication coming not just from the administration, but from governors across the country, that everyone's in this, that if anyone comes off the line, so to speak, they're endangering somebody else. I think that signal is getting through. But remember, America's a country built on freedom and on the ability to decide what you want to do, when you want to do it, how you want to do it. This is a habit we have to kind of break right now on behalf and in the name of the common good. So I think we're adjusting. I think we're getting there. But when you hear the governor of New York, and also reinforced by Mayor de Blasio in New York City, saying we can't handle this. That's about the only time I can remember a message coming from New York City in particular that said we aren't up to this task alone. We need help. And that says also that structurally, to get into what Julie and Peter were saying and suggesting, structurally, I think what's going to happen in America, and I'm sure it will happen in other countries around the world, we're now going to make this, let's say, public health a major league priority. And I think we're going to have to find a way to create a government system that can rapidly and effectively move to tamp down threats as we start to move into the future.
Peter, you mentioned a moment ago Italy by way of comparison with what's going on in the United States. I was reporting out of Italy at the end of February about the coronavirus outbreak, and it was shocking to see how quickly the virus spread across the country despite the efforts at quarantine and lockdown. I'm curious, from your point of view, if what you're seeing in the U.S. mirrors to some extent what happened in Italy, and also if you believe that the U.S. will further toughen movement restrictions to try and curb the spread.
The U.S. is unfortunately very much following in Italy's footsteps, and many of us saw this coming several weeks ago. And unfortunately, the action taken was not early enough to prevent that. So we're certainly seeing that in New York right now. And of course, the risk is that we may, over the next several weeks, begin to see multiple different epicenters like New York or like Lombardo across the U.S. in the weeks to come. I do think that the restrictions will need to be strengthened and also broadened, right? So there has been a national call around social distancing, but it is still a bit patchwork, and you're seeing this being done much more aggressively in some states and localities over others. I would favor at this point, there's so much community transmission across the US right now. It's really high time to start thinking about nationalizing this response and having stricter social distancing guidelines that are implemented and hopefully enforced everywhere in the country, as well as better coordination to build up our health system.
All right, so I want to step back for a moment and take a look at another dimension of all this. So the coronavirus pandemic has become a political issue in the U.S. Let's take a listen to the two main candidates for the Democratic nomination for this year's presidential election.
I hope very much that out of this terrible, terrible tragedy, we do some fundamental rethinking about the nature of American society, what our moral statements are, what our priorities are. And if we can do that, then at least there will be something good out of the terrible suffering that so many of us are experiencing right now.
Look, the coronavirus is not the president's fault, but the slow response, the failure to get going right away, the inability to do the things that needed to be done quickly, they are things that they can't continue. We're going to go through another phase of this, and we have to be ahead of the curve, not behind the curve like we were last time.
Adam, you heard Joe Biden and Bernie Sanders there talk about the ramifications of this crisis. Obviously, political candidates are saying they don't want to politicize this, but politics will be a factor in all of this. So I'm curious to know, do you think that healthcare will become more of an immediate issue now when it comes to the presidential election?
Well, there's no question. I think healthcare was always a top 3, top 4 issue. I think there is no other issue that comes close to it right now. It's interesting when you're playing these clips, when you could reflect on the role of politics now in American life, which obviously has been far lessened because of the crisis at hand. But there are two things that are obvious already. Number one is that this has become a referendum. This health pandemic has become a referendum on the president of the United States. If Donald Trump is perceived to have handled it well, decently well or better, he stands obviously a great chance of not only re-election, but maybe in a big way. If he doesn't handle it well, I think everything is suddenly up in the air. The second thing that's happening here is with Joe Biden in particular, the presumptive, let's say he's the presumptive Democratic nominee, even though Bernie Sanders does not want to concede. His problem, Joe Biden's problem, beyond the obvious, is he has an inter-party and an intra-party challenge. The intra-party challenge is with Bernie Sanders, that the field has not been cleared, and there's more and more suggestions that people like Governor Andrew Cuomo, perhaps Governor Newsom in California, Governor Whitmer in Michigan could be considered as a potential nominees because of the increasing public roles they're playing. But he also has an inter-party problem here in terms of being able to prosecute this case without having those kinds of suggestions that kind of tear down the inevitability of Joe Biden as the nominee coming at him every day. He's trying as best he can with his very frequent pronouncements coming from his well-lit movie studio now study. But I think he is less relevant now. What is relevant to all of us is whether or not this administration is going to be able to handle this pandemic in a way we need and we expect, and that is the politics of the moment.
Julie, how much worse is this expected to get in the U.S.? And also, can the healthcare system, being what it is right now, cope with this?
It's expected to get worse in the U.S. I mean, to put it frankly, we're still a good 2 weeks away from the peak of the epidemic in the US based on all the data that we have now. The cases across the US are increasing basically threefold every day. It is obviously very patchy across communities. And the outbreak in the US began on the coasts, the East Coast and the West Coast, that have the most travel and the most travelers arriving from the initially affected regions. But the outbreak is spreading, and we have, because we were late out of the gate on getting testing into place, we don't have a really good handle on how many communities already might have local transmission with a great number of asymptomatic cases or mildly symptomatic cases that are masking the extent of the outbreak. So there are going to be hospitals in communities across the US that simply do not have enough intensive care beds and intensive care nurses or enough equipment to care for the coming caseload. The estimate, again, this is a model, but the estimate is that at the peak of infection in about 2 weeks, we're going to have in the US a shortage of intensive care beds of more than 13,000 beds and more than 26,000 ventilators. And that's a shortage that right now healthcare systems across the country understand is coming and are scrambling to try to accommodate. But again, that those decisions and the ability to get them into place has had to happen with state and local leadership. And we have seen, I think the great news is we have seen some very strong state and local leadership and decision making on how best to make sure that those in greatest need have access to resources and that we protect our health workers. But the truth is that globally, supply chains have been under stress, and trying to address those shortcomings in the middle of the crisis is a challenge and a scramble. And it's a place where, the federal government can provide guidance, technical guidance, risk analysis, risk communications, and clear leadership. But ultimately, for public health, the state and local decision makers are the ones who are making sure that they understand the situation in their localities and providing the leadership for social distancing and for supporting the healthcare systems and healthcare professionals.
Peter, I saw you nodding along to a lot of what Julie was saying. Did you want to make a point?
Yeah, I think that's exactly right. It's unfortunate because I think a lot of this was preventable, but the worst is yet to come. We've seen estimates that deaths could number in the hundreds of thousands, and possibly even further under a worst case scenario. I think we'll be able to avoid that worst case scenario, but there's a lot of work to be done, and so social distancing now can buy us time to do all of the things that Julie was talking about, do everything we can to reinforce the healthcare system, to acquire the PPE that's necessary, to ramp up testing, which is ultimately what's also going to help us get out of this as well. We can't all stay on lockdown forever. And once we get past the peak, we need to be able to think about how we're going to be able to safely start to ease some of those restrictions and get society and the economy working again. We'll only be able to do that if we have the intelligence that comes from widespread testing. And so all of these things need to be happening at the same time.
Adam, we don't have a whole lot of time left, so let me ask you quickly. The United States, of course, has been so polarized socially and politically these past few years. Is this pandemic, from your perspective, going to pull people closer together, or will it drive them further apart?
That's a great question. The bottom line is we don't know yet. I mean, this country has really been riven by not just partisan differences, but geographic, demographic, ideological differences for a long time, and it's gotten worse. You would think this is the moment that America would pull together in common interest for all the right reasons. I hope that happens. I'm concerned about one more thing, and I'll make it very fast. It's not just a health pandemic we're facing. It's also an emotional, psychological pandemic we're about to face. Because if we stay on virtual lockdown for another couple of weeks, couple of months, there's going to be another wave of reaction to all this. And that's where the divisiveness in America really concerns me and a lot of others.
All right, well, we have run out of time, so we're going to have to leave it there. Thanks so much to all of our guests, Julie Fischer, Dr. Peter Drobak, and Adam Goodman. And thank you, too, for watching. You can see the program again anytime by visiting our website, aljazeera.com. And for further discussion, go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Mohammed Jamjoom, and the whole team here, bye for now.